on, buddy.
In the last episode of At the Vets,
Hey, Top.
Top the Frenchie has to lose both eyeballs.
His eyes are very bulging, very inflamed, very red.
Heart pain, heartbreaking.
All right.
Dr. Wu gets his hands dirty
The stool just way bigger than the pelvic canal. Smelly is an understatement.
and Ginger is fighting for his life.
We're going to try and put a stomach tube in him. We only got a few minutes.
I cannot let him die.
And with pet ownership on the rise, vets in Singapore are busier than ever. But in recent years, a spotlight has been cast on the mental health challenges faced by vets.
We have too many vets who get depressed. We have too many vets leaving the profession, going to some other profession. And that is a tragedy.
For 3 months, On the Red Dot enters the clinics of some of Singapore's busiest vets for a rare glimpse at the vets.
This for Top later. He's Top, he's 6 years old. Today he's going for an enucleation operation. He has to do the removal eyeballs. Heart pain, heartbreaking.
Top's trouble started when he visited his previous vet for a cataract surgery. Cataracts happen when the lens of the eyes get cloudy, but the surgery did not go well.
I was told the surgery was a simple one and Top can recover on the same day. After the surgery, the cloudiness came back again. I sent him back to the doctor, and after all kinds of treatment, he just got worse.
Possibly due to complications from the surgery, Top developed glaucoma. This happens when pressure builds up in the eyeballs. Right now, the French Bulldog is in a tremendous amount of pain. What's worse, Top has become blind.
All right, you walk with me together. Oh, we'll bring him to the back. Okay, come on, Top.
Come on, buddy.
Anne desperately wants to heal Top. She heard about Gentle Oak from a friend and decided to bring Top to see Dr. Lee.
So Top was presented to me as a second opinion for glaucoma in both eyes. His eyes are very bulging, very inflamed, very red. It's the pressure of the eyeball. It was definitely very much elevated. So in cases like for Top, it is actually a painful scenario.
Hey, Top.
It's okay, buddy. In Top's case, it's really just removing the source of pain rather than anything else. Sight is lost, and unfortunately that's non-reversible.
He was a happy boy and he was very active. The thought of him being blind, I was thinking how life is going to be like. But I told myself, if this is our challenge, we must overcome it. I'm nervous for Top because he's already gone through so much pain, so I can only be relieved when I personally see him after surgery.
Meanwhile, at the Animal Wellness Center, 12-year-old Ginger is fighting for his life.
All right, go in. Start him one drip first. Get his blood pressure up. He feels very cold. Get a warming pad going.
Very cold. Okay. His legs, his limbs are very cold.
No, his temperature is bad. It's very low. Get everything ready, please. Ginger has lymphoma. You know, it's a tumor that's growing in the eye. So we gave him chemotherapy. He got really well. It lasted only for a month or so, and then it started to go downhill. He's got an ulcer in the right eye that is really not healing. He's actually knocking on death's doorstep at the moment.
Because of the cancer resulting in kidney issues, Ginger has lost his appetite and stopped eating on his own.
He has very little reserves if he doesn't eat. Ginger is a fighter, we know that. We're going to try and put a stomach tube in him and see if we can perk him up a bit. Just hope that he'll start to respond.
I call him Mr. Ginger. He doesn't like to be cuddled, doesn't like to be carried, but he likes to be petted. I cannot let him die. Yeah, so we have to try our best.
Ginger hasn't been eating for almost a week. Dr. Lai has to move fast in order to get Ginger the nutrition he badly needs. At this point, it's Ginger's only chance of survival.
Get everything ready. We only got a few minutes. Please remain focused, guys. All right, my sweetheart. We're gonna put you to sleep for a little while, okay? Yes, my sweetheart. Open the mouth a bit. Thank you.
Dr. Lai is inserting a feeding tube through the esophagus and directly to the stomach. This will allow Ginger to receive nutrition even if he is unable to eat on his own.
My clinic is probably always the last resort, so people come when they've run out of all options. The bad thing about it is by the time they come to me, it's usually too late. And all I wind up doing is keeping the animal comfortable till he passes. All right, so we place the stomach tube, and then now we need to just take an X-ray, make sure it's in place.
Back at Gentle Oak Veterinary Clinic, Dr. Lee is about to remove the eyeballs of Top, the 6-year-old French Bulldog.
So our plan is to do the surgery for the worst of eye first. If he is nice and stable, we will also then move on to the left side.
Top has lived in constant pain from severe glaucoma, likely as a result of complications from a double cataract surgery at a different clinic. Because the surgery is around the delicate areas of the eye, Dr. Lee will have to work with a great deal of care.
Any surgery, even a routine sterilization, can turn into a very dicey situation. We never know. I guess the thing is, be as prepped as we can, be ready to expect the unexpected. Hopefully it will be a nice, uneventful scenario. At this point in time, what we're literally trying to do is to dissect that eyeball out. There's few muscle attachments holding the eye in. What I'm trying to do now is working my way around the eyeball, transecting the muscular attachments and the connective tissue with it.
But soon, Dr. Lee's hopes for an uneventful surgery are dashed.
Fair bit more bleeding than what we would like. This eye has been traumatized for quite a while. A lot of times when we have ruptured glaucoma, the body is basically trying to heal itself, so it will always try and drag more blood vessels into that area.
And Dr. Lee soon runs into another complication.
The eyelid keeps closing down on the eye. And the eyelid retractor is a little bit too small. Top, because he's a Frenchie, he's also got quite a lot of spare skin, and his skin condition is not the best as well. I'll probably need to get Dr. Alice to come and just hold the surgical site a little bit more open for me so I get better access. Yeah, so the lateral one and the dorsal one's out. Okay. I need to get that one.
I think I have to go from here.
A bit of bleeding.
After almost an hour, Dr. Lee, with the help of Dr. Liao, finally managed to cut the optic nerve and remove the eyeball. But Top's bleeding has not stopped. If this continues, it could lead to further complications.
We're just putting physical pressure on the area to try and stop and slow the bleeding. We just hold this and just wait. This is like the longest 2 minutes.
The bleeding is finally stanched.
I think if we close it up, it should be okay.
Alright, so we're at pretty much the final stages of the procedure. These are all absorbable suture materials here. So he's waking up already.
Due to the risks, Dr. Lee has decided to end the operation here.
The decision is for us to just only remove the right eye today. My concern is that potentially we may need to look at another hour plus of surgical time. That's putting him under more anesthetic risks. And if he is going to continuously also bleed in the same amount, it's not a situation I will be very comfortable to be in for him. As much as possible, we want to minimize blood loss.
At the Advanced Vet Care Veterinary Center, Putih, the stray cat, has been brought in by his carer, Linda.
When I first met Putih about 10, 11 years ago, his owner left the house and they didn't bring him along. And then I found him. He was so thin like a plank, you know. He was starving actually. So then I started feeding him. I've been feeding him ever since. Today, I'm hoping Dr. Nicholas can ease his constipation.
Hi Linda, how are you?
Hi, okay. This is Putih. So every time he wants to poop, he has difficulty in pooping. But recently, it's become worse. When he tries to poop, and then he finds it so hard, then he starts to vomit out. And he vomits all over the place.
Okay, but appetite is still okay?
Appetite
Still
is okay.
eat?
Oh yeah,
Okay,
he still
alright.
eats.
For community cats with no owners, carers like Linda often foot the vet bills.
It's not that I'm rich or what, but I can still afford to pay for him. That's it.
Okay, Ken, no problem. Let me bring him inside. And then I'll have a few first, of course. Then take an x-ray and then we see.
Okay, okay.
Ken, come.
Okay, thank you.
Thank you. Okay. Constipation. A lot of times, I don't think anyone can really tell for stray cats because people don't know where they go to do their toilet. Okay. Linda is very dedicated and she's always spending a lot of time with these stray cats. She knows where the cat goes to do a toilet. So we're gonna do a physical exam. All right, okay. Okay, he's quite fierce on this cat. All right, buddy. Oh yeah, there's a lot of stools in there. Okay, Ken, we'll go and take some x-rays. So sometimes these community cats, they're not very sociable sometimes. All right.
Constipation may seem innocuous, but in severe cases where the animal is unable to pass stool, it can be life-threatening. An X-ray will reveal the extent of Putih's constipation.
There are many factors that contribute to a cat being constipated. It could be due to food, but it could be due to genetic factors as well. See this white bit of thing here? Now this is actually a big piece of stool. And if you compare the diameter or the width of the pelvis, right, this stool is almost bigger than the pelvic diameter, and so there's no way this stool will actually come out. It's like a cork that's stuck here, and that's why Putih is having so much difficulties as you're squeezing and squeezing, as a result vomiting because it's so much abdominal effort. No? So my aim today, we are going to manually remove this as hard as a rock. So we call it a poop stone. And hopefully by doing that, we relieve the stool that's coming up in front of it and things will get better. Okay, be good. So the cat is anesthetized at the moment.
The procedure begins with an enema for Putih.
It's just a bit of warm water together with some lubrication, basically to soften and to lubricate the stools so it comes out a bit easier. We're going to put this in through this tube into the rectum, and then we pump in a lot of fluid because it's very dry in there. The stools will sort of act as a sponge and absorb a little bit of this fluid. Okay. So when it's all softened, we had to manually, digitally remove the stools from the colon and the rectum. The stools were quite big. We had to break it down into many pieces. I don't think there's a way to remove the stools without breaking it down. It's just way bigger than the pelvic canal, so they wouldn't have passed through. There was quite substantial amounts. Smelly is an understatement. It smells pretty bad. It'll be over very soon. Our job is pretty varied. We get to do surgeries, we get to do vaccinations, but sometimes you have to go and do something like this. And sometimes you go home with your hands smelling like stools for maybe at least half a day to a day. It's just many facets of the job, and I mean, I don't complain. It's just satisfying to know that the cat can poo again. I think it's all done. I don't feel any more stools in there. The cat has been suffering, and it's extremely uncomfortable. I think this cat has been dealing with it for quite a long time, a few weeks already. So I think it's definitely going to be very comfortable after this.
Ginger has been suffering from cancer and has not been eating for almost a week. Dr. Lai has inserted a feeding tube and his condition has stabilized. But he is not out of the woods yet. There is still a matter of an ulcer in his cornea that is having trouble healing.
So the next step is to now clear up his eyes. I need suture material, please. So cats and dogs have a nictitating membrane, which is the third eyelid we some commonly known as. This third eyelid crosses the eye. We don't have it, but dogs and cats have it. And we can use that as a bandage.
In this procedure, Dr. Lai is stitching the nictitating membrane over the cornea in order to provide a protective layer and help the ulcer heal on its own.
Just stitched it to the edge there with one stitch. It's all done, and it helps to protect the cornea. So that's a third eyelid flap. So this way it protects the cornea until it heals. It heals faster as well because the third eyelid has a gland in there which provides nutrients and a blood supply. All right, let's clean him up. Okay. Well, if nothing works within the next 5 to 7 days, I think it's not going to work. He has kidney failure as well. I know it's a lot of work, but the owner of this cat really loves it. What would you do? You don't give up, right? There's always something out there you can try. Okay, put him back in the cage, let him warm up. So that's it. I took euthanasia now to be only my last resort when I can't really help it anymore and the pet is really suffering. I was asked once, would you ever get used to euthanasia? Oh, my answer is very quick. Never. The day I get used to euthanizing, I quit being a vet. As long as the pet is alive and as long as there is still a glimmer of hope, I would never say no to a dog or a cat or a stray.
At Gentle Oak Veterinary Clinic, Anne has arrived to bring Top home after the surgery.
Surgery went well, but I did the right eye first. I didn't do both. Because
anesthesia.
anesthesia is one thing, and also because it's a fair bit of bleeding, so I didn't want to do both sides.
Okay. Knowing Dr. Lee has just removed one eye, I have very mixed feelings. I'm heartbroken that Top needs to go through another surgery, but I also understand that because of his condition, it is better for him and is safer.
Alrighty, come on, buddy. Come on, Toby. Oh, you cannot see.
Darling boy. Boo. How are you? Okay, Top, come down. I am relieved seeing Top after surgery because I can see him walk on his own and he's not so moody. Hopefully, when I bring him home, everything will be okay.
I can feel him like more relief. Yeah, I'm happy since the first operation had done. So I'll see how it goes. Yeah.
We are done. Let's go back. Let's go back.
Dogs and cats and animals in general, they are so great at adapting. If they can't see, they'll use some other senses to cope. And they are completely blind. Some dogs are even born blind, and they do remarkably well. So with Top, he still has that one more eye enucleation to go, but once that's done and that surgical site's healed up, he should be nicely pain-free and should go on to lead a very happy life with Anne.
Come back.
Back at home, Ginger the tabby has made a surprising recovery.
After the tube was put in, it helped us a lot to feed him. Then he got stronger. When his condition was more stable, Dr. Lai started putting him back on chemo and also on steroid to boost him, to help him. Now his appetite is increasing more and more. I think it's really quite miraculous because like what Dr. Lai said, he's a fighter. And every time we thought that we're going to lose him, he comes back again. And that gives me the strength to continue. He's actually still very serious about living on. So we owe it to him to help him. We just want to let him live out the rest of his days happy, comfortably, just enjoy food, enjoy sleep, enjoy being served by us.
Top eventually had surgery on his left eye 5 weeks later and has made a full recovery free of pain. And life is back to normal for Putih, the community cat, and Linda.
Yes. Such a drama queen. The veterinary profession is a very stressful profession. But the best part of being a vet is getting the patient better. You know why? Because when the patient gets better, the owner gets better. So you're treating two patients, and the bonus you get is a double bonus.
It doesn't matter whether it's a dog or cat or fish, they are still a valuable part of the family. It's not about what crazy surgery, what out of this world procedure that you can do. It's more, for me, the ability to help a family member, really, and the owners appreciating the work really makes me feel that my job is really meaningful.
The best thing about being a vet is, I guess, get paid to play with cute puppies. But truly seeing your patients get better, even when the odds are against them. And somehow we manage to cross that huge hurdle. That's always the best thing ever. Moments like that makes it all worthwhile and it just reminds you that, you know what, whatever we do can make a difference.